Okay, so it's time for part 4. This is the perio section of REBS. So the tough part here is finding a patient that is acceptable. So what you need to do for the perio section of REBS is 1 or 2 quadrants of scaling and root planing. If you're doing 1 quadrant, or between the 2 quadrants, it doesn't really matter. You need to have 6 teeth with 2 of them being adjacent posterior teeth, and 1 of them must be a molar. So that being said, you can do, for example, you can have 1 first molar touching 1 second molar, or 1 first molar touching the second premolar, or the second molar touching the third molar. Any of these are acceptable. You need at least 8 surface of some gingival calculus present between the 1 or 2 quadrants, however many you want to do, and 6 of these 8 pieces must be in the posterior teeth. Okay, you need at least 1 pocket depth of 5 millimeters or more on 2 of the teeth in either 1 or 2 quadrants. There can be no acute periapical or periodontal conditions. Any partially erupted third molars do not qualify, and they will not be graded. However, if a third molar is fully erupted, then it will be graded, and it is counted towards your number of teeth and number of pieces of calculus. Patient acceptance. So unlike the operative section, there is no provisional acceptance here. Here you bring in your patient on the day of the exam. You can submit them for approval, and that day you must do the procedure. So you can't submit for approval one day and then do the procedure the next day. It all has to be the same day. Once again, you cannot have any electronics in the grading area, and you are supposed to anesthetize the quadrants that you plan to do before you even submit them for approval. Okay, so before you get your approval, your patient should already be numb when they're going in to get checked if they are eligible. You want to give to the patient the perio worksheet, which you are to complete, and you can see that in the candidate guide. On there, you'll put your patient's first name, candidate guide, quadrants, circle the right quadrant, list the teeth, put X's on teeth that are missing, put X's for where there's subgingival calculus, and record all probing depths of 3 or greater. Then you will check the acceptance box and list all medication. If there is none, write none. Also list the anesthesia that was given. With it, you're also expected to provide an FMX that is within 3 years. The FMX should include PAs of everything, including the third molars. If the patient cannot have PAs done of the third molars, you can write a note to the examiners saying that it was not possible and that is still acceptable. Do not staple the FMX, have it paper clipped behind the worksheet with your candidate number and the patient's first name. You can also submit it digitally with the same format as always, your candidate number, the patient's first name, and then write perio. You should have a completed medical history and consent form, which was initialed by the floor examiners before you submitted the patient for grading or acceptance. Okay, so this all has to be completed before. Then you will provide them with a tray. The tray will have a metal front surface mirror, a new Explorer, the 1112, which you should be aware of by now, and a color-coded perio probe, as we use always, the 369, and 3 2x2 gauze in an open autoclave bag, and then the paperwork on top. The patient should be in a bib with your candidate number on the upper right, and the patient should have eye protection. So, accepted versus rejected. If you are accepted, you can start. If you are rejected, you will receive a pink slip, and it will tell you the reason why you were rejected, and you will receive a 10% deduction in the perio section. You will not be given back the medical history or consent form. You will have to make new ones. If you submitted the patient for just 1 quadrant, and now you want to attempt to submit the same patient for 2 quadrants, you are allowed to do so. You will just fill out new medical history, consent, perio worksheet, everything, and you still will have that 10% deduction from the first round. But at least you can give it now a second try on the same patient. Treatment. So as I said before, you have to complete perio treatment on the day that it was accepted. If you do not, you have to resubmit the patient for acceptance the next day. You're graded on your ability to remove calculus and root plane, all teeth in the quad or quadrants. You can use a sonic device, so whatever you may bring. However, you cannot bring any hand pieces or chemicals for calculus removal. Any major tissue trauma will result in failure of the periodontal section. So any big lacerations, anything like that, you will fail and you will not be allowed to retake that weekend. When you're completely done with your perio section, place an X on the worksheet where it says treatment grade. Submit your radiographs again. Make a tray with the exact same materials, the mirror, the explorer, the perio probe, and 3 2x2 gauze. Patient should be in eye protection and a bib with your candidate number on the upper right sides. If your patient is starting to get not numb anymore, you can re-anesthetize them for comfort. Once you get the patient back, you are allowed to release them only if everything is completed. If any of the initials are missing on your paperwork, you have to notify the floor examiner. Be sure to give your patient a yellow copy of follow-up agreement. Have the patient complete a patient questionnaire. Notify the floor examiners that you are done, and they will dismiss your patient. So don't let your patient just leave the building, okay? Make sure that everything is signed, dated, everything is good. Have the floor examiner confirm that everything is good, and the floor examiner will tell you that your patient is free to go. Scoring. So this one goes kind of out of 100%. And you need 75% to pass the test. You lose 12.5% for every piece of calculus that's left. So therefore, 3 pieces is a failure. 2 pieces is the minimum you need to pass. If you fail, you can retake it the same weekend if you have time. Patient rejection. As I said before, that's a 10% deduction on the first round. So if you receive that 10% deduction and then you leave, you can only leave 1 piece of calculus. If you leave 2, you will fail. Major tissue trauma will auto-fail you, and you cannot even retake it that weekend, so be very careful. And as always, there are late penalties. 1 to 5 minutes is 4%, 6 to 10 minutes 8%, 11 to 15 minutes 12%, 16 plus minutes is a fail. And that is it for the perio section. This one is probably the most straightforward to read in the candidate guide as well. And from my understanding, we also will have the Cavitrons available to all students, but we're going to sign them out and kind of have people use them at different times. All right.